Dialectical Behaviour Therapy, or DBT as it is frequently referred to, is an evidence-based psychological treatment. It was developed in the 1980s in America by Marsha Linehan and intended for people who experience emotions very intensely and who struggle to control or to regulate these emotions in a healthy way. DBT has its origins in cognitive behavioural therapy, and yet it is significantly different from CBT. DBT's focus is not just on challenging unhelpful thoughts and behaviours, as CBT does, but also on accepting ourselves wherever we are at. DBT therefore uses strategies for change and strategies for acceptance, believing that for some people both are important. Indeed, the word dialectical means the coexistence of opposing truths, such as acceptance and change.
DBT is suitable for people who have difficulty coping with and regulating their emotions. You may find that you live a painful and chaotic life and feel out of control of your behaviour and do risky things. You may feel suicidal, use deliberate self-harm or alcohol and drugs in order to cope with the difficult emotions. You may feel depressed or anxious and have quick changes and feeling different strong emotions. You may have difficulty in relationships, feeling unable to trust others or feeling that you're going to be abandoned by them. Marsha Linehan believes that one of the main reasons people do desperate things is because they have learned effective but harmful strategies for coping with strong emotions, particularly painful ones. When people feel emotional pain, the instinct is to block this. Blocking it may cause temporary relief, but causes more problems in the longer term. If any of these sound familiar to you, then DBT could be a treatment that could be helpful. DBT has a rich variety of skills which are taught in the skills training group. There are 4 modules of skills in DBT, 2 that focus on acceptance and 2 on change. The modules are mindfulness and distress tolerance, which focus on acceptance, and emotion regulation and interpersonal effectiveness, which focus on change. Mindfulness is the first module taught and is at the core of DBT skills. It teaches going inside yourself and learning to observe the present moment with awareness and participate in life with the aim of letting go of being judgmental. The mindfulness skills teach us to be in the present moment rather than ruminating about the past or worrying about the future. Distress tolerance focuses on learning how to tolerate distress. It teaches skills to help manage a crisis effectively and also accept reality and even finding meaning for your distress. The skills teach us to accept in a non-judgmental way both yourself and your current situation. Emotion regulation focuses on emotion. What is their function, their different components, how to express them, as well as how to regulate and change the unwanted ones. It's about learning how to gain more control over the intensity of emotion and the ability to either problem solve them or act in a way opposite to them. It also teaches how to reduce our vulnerability to negative emotion. Interpersonal effectiveness teaches us how to ask for our needs to be met or say no in a way that's going to encourage people to either give us what we need or respect our decision if we say no. It also looks at having healthy relationships and ending destructive ones. The module also explores being dialectical and how to validate yourself and others.
We are a niche DBT service working predominantly in the Sussex area. The team known as DBT Sussex has been established since 2013, providing the full programme to our community across Sussex. Since 2019, we have been based in Hove, working together with Phoenix Therapy Practice. Currently, the DBT Sussex team comprises of Jackie Patterson, Laura Finley, Lisa Davies, Rachel Singh and Maz Michael. As a team, we agree to hold in mind Dr. Linehan's core beliefs which are to make compassionate and scientifically valid treatments available to all people with complex emotional difficulties and disorders. We endeavour to carry this out by offering the following services: providing the full programme to people living in the community, locally and nationally. Our programme comprises of one-to-one sessions alongside weekly group sessions facilitated by 2 qualified DBT therapists. We, the DBT Sussex team, take pride in considering our clinical competence, which is why we believe in the importance of meeting regularly for a weekly team consultation. In this space, we share knowledge, training, and support one another in the DBT team in order to work effectively and ethically with our clients. Currently, we are working carefully to ensure we are COVID secure and following government guidelines. This means that currently we are able to offer assessments. However, we are providing these remotely via a secure conferencing platform. So, if you are interested in finding out more about this unique therapy, then firstly, please feel free to contact us via Phoenix Therapy Practice, where in the first instance we will invite you to come along for a free initial assessment. Following on from that, if we think you are suitable, we will invite you to attend a DBT assessments with one of our DBT practitioners. The cost for the DBT assessment is £60. We look forward to welcoming you to our service.